We're going to be looking at hanging IVs. And the hanging IV medicines is in many ways you start in the same ways that you would with any oral medicines or any other medicines. You're going to verify the physician order. You are going to check the medicine and be sure that the patient doesn't have any allergies to it. So you're going to verify the allergies of the patient. You are going to gather your equipment, and you're going to have a primary bag. If you're doing a piggyback, you will have a secondary bag. Primary bag, secondary bag. You will have primary and secondary tubing, which is clearly identified, particularly the secondary on the cover. And you will need some alcohol swabs. If you want to wear gloves, you certainly may. In most IV fluids, it isn't necessary to wear gloves, although with some oncology medicines, the nurses will always wear gloves and sometimes even double glove because the medicines are so corrosive to tissue. You will want to wash your hands. And you're going to, as always, verify patient identity. And you're going to use at least 2 methods of verifying patient identity. Now, the initial spiking of bags and priming of the tubing is generally done in the med room as opposed to at the patient's bedside. So you will remove the tubing. And you can just throw it away as you go. You're going to remove the wrappers. Now looking quickly at the tubing, spike, drip chamber, there is a small filter here, there is the piggyback port. This part under the blue tubing for the Alaris tubing is the part that goes within the pump. Here is your rolling clamp. At the bottom there is a medication port, and then the other end, the distal end, which attaches to your patient. Note that both ends have covers on them, have caps on them. That is deliberate because both those ends must remain sterile. You don't want them to touch against anything other than where they belong. Okay? We are going to first spike our primary bag. We've already verified the order. Now, these bags, with new bags, you can spike them with them hanging up. With these bags, you cannot because they've been opened before. Without allowing anything to touch either the port of the bag, verify in looking at the fluids, you will verify also not only what the fluid is, but also the expiration date on the fluid. This one is slightly expired, August of 14. Okay, so now we are ready to spike the bag on the primary fluid. Notice I have removed the cap from this without letting anything touch it. I'm removing the cap from the tubing without letting anything touch it, because it must remain sterile, and so must this. You are then going to spike the bag by putting the spike into the port before you turn it over, and you can do this when you first take it out. You want to be sure that it is clamped closed. With a rolling clamp, you simply roll it toward the distal end. Hang up your fluid. You will be doing this in the med room. You can generally hang this. There is usually somewhere where you can hang this up. When you hang it at the pump, make sure that the label is toward the front so anyone coming can see exactly what is hanging. Okay, now we're ready to prime the tubing. You start priming the tubing by priming the drip chamber. You're going to squeeze and release, and the drip chamber should be approximately 1/3 to 1/2 full. Wow. Okay. Then we are going to watch the drip chamber. We are going to unclamp until we see it begin to drip here. And you can follow the leading edge of the fluid as it comes down the tubing. I don't know if you can see that from there. When you get to the port, you want the port to be upside down. So it goes past the port. At that point, you can clamp it off and make sure there's no air remaining in the port. You can do this in one of a couple of ways, as I am doing it, to get the bubbles to go on up. Keep the port upside down because bubbles always want to rise. Okay. And just keep the flow going. If you turn it up and keep it going uphill, the air will keep traveling up and the bubbles should keep traveling up as well. If you do this too fast, you're going to have more bubbles. I'm going to drape this over this so it won't be in the wastebasket. We're getting to the second port. Again, it has to be upside down. You want to tap it to get rid of the bubbles. You want those bubbles to go out. And once it's dripping from the end and the entire tubing is filled with fluid, clamp it back down. Okay? Now we are ready at this point to place it at the patient's bedside. We're going to take it into the patient's room and hang it on the pump, again with the label toward the front, and we're going to put it in the pump. We're going to turn the pump on, and there's a button here that says System On. Most of the hospitals locally have the Alaris pumps, so we're teaching you on the pumps you will be using in the hospital. Notice there are actually, this is PC, that's the pump controller. You'll notice that the two of these are labeled as pumps, and the advantage of this pump is that you can add additional pumps on the side. This controller can control up to 5 lines at once. Okay? Now, new patient, no. And basically the next question is saying, is it the same old meds that they've been on? Yes. Now, which pump do we want to use? You'll notice that they are identified on the front by A and B. We're going to use pump B. And you tell it here by pushing channel select to tell it which pump it's going to be working with. Okay? Now I'm just ended up with A. No? Okay. Okay, it decided it was going to use A. So we're going to put this in, and you can and probably should put it in ahead of time before you turn the pump on. You're going to remove this protective cover. Going to make sure there are no bubbles in this part that's going to go inside the pump. Okay. And this softer tubing here will go into the pump. This little platform goes into this place at the bottom. The top goes in here. Make sure it's between the two flanges at the bottom. Close and lock the pump. All right. Now we're going to allow this, then you would have it in the pump and you would attach it to the patient, cleaning the port first. If you learn nothing else in this today, you never put anything into any IV port at any time without cleaning the port first. I have brought this to the bedside where the patient is with their IV. Now, this is still sterile. I've still got a cap on it. I am going to clean the port. And your particular facility will probably have some rules as to how they want this done. Now, without letting anything touch that, I will remove the cap from the IV line, put it into place, and screw it into place. You may or may not want to put some tape here. unclamp because it's ready for fluid now, and we're going to set the pump. Now in setting these pumps, and we can work on this further in the lab beyond what you're seeing here on the video, we have said, okay, we're working with channel A because that's the channel that the tubing is in, and we're working with a basic infusion. Now we're going to set a rate, and we're going to say that the doctor wants this to run at 125. You have to tell it what you're setting first. 125. Okay, and then VTBI, which is volume to be infused, that's how much is in the bag. We're going to say this is a full bag, but we don't want to put 1,000 milliliters in there because we don't want this running dry before it's replaced. So we're going to put at 125, about half of that is 60, so we'll put 940 in there. And then it says, enter VTBI. Now it says press start. So it actually tells you step by step what to do. Start is down here in the corner. You press start. And it's saying, oops, there's a problem. There's a problem checking the line. Why might there be a problem? Because we haven't unclamped. If we unclamp, it turns to green and it says, I'm a happy camper. Okay? So this is now running. The fluid is going in. You never walk away without verifying that it's dripping, that the correct bag is dripping. Okay? Now we're ready for the piggyback.
Hold on.
The doctor has ordered a piggyback. The piggybacks are smaller bags. Your primaries are generally 500 to 1,000 milliliter bags. The piggybacks are 50, 100, 250. That's the usual sizes of your piggybacks. So here we have a piggyback. Pardon me, I just threw something away that I'm going to need. You didn't see that. Okay, let's look at some differences in the tubing. Again, the two ends are covered. They're kept sterile. But notice it's much shorter. That's because it only has to go from the bag to the primary tubing. It doesn't have to go clear to the patient. And it has no ports. So we want first, before we do anything else, to clamp this off. If you lose a little bit of fluid because you forget to clamp off your primary, it's no big deal, it's a primary fluid, but if I lose fluid here, I'm losing medicine. Secondary bag, upside down, pull the plug. Again, nothing touches this. Uncover the spike, spike your bag. It's already clamped down, so it is safe to hang. And again, you want to hang this so that what it is can be seen clearly from the front of the pump as you walk up to the pump. Okay. Now, one of the things you will need to do is to drop the primary bag. And I have in the packaging for the secondary something with which to do that. So we don't need to stop the pump or anything else, but we're going to drop the primary bag here. Okay. Now with the secondary bag, we are ready to, I'm going to bring it over here so you can see it more clearly. We're going to prime the tubing in the same way we did with the primary. We're going to prime the drip chamber, and we're going to let the fluid run through to the end, keeping track of it. You don't have to worry about the ports this time, so it's relatively quick. There it comes. And it is primed. You attach this to the primary tubing at the piggyback port, which is the port before it goes into the pump. If you try to put it on the lower one, the pump has no control over it. By putting it into the piggyback port, that's before it goes through the pump, and the pump controls both fluids at that point. Okay, we're going to clean the port again before we attach anything to it. And we're going to attach the piggyback, uncap it. Again, I'm not letting anything touch the port or the end of the line. And it goes in and screws in place. At that point, your pump is in control. It is safe to unclamp your secondary line. Now, setting the secondary, we again call the controller's attention to us by hitting channel select. So it says, hey controller, and the controller says, yeah, A, what do you want? And it tells you right up here that it's talking to A. And down here at the bottom, it says secondary. So we're going to push that. We are just going to do a basic secondary. There are in your pumps going to be specific medicines and specific dosages, and if those match with what you're giving, you can use that. Now the rate here, we're going to say it's 75. Now let's see how much is in the bag, 100. We're going to say it's 100 milliliters an hour. So rate, 100. Okay, I need to back that up. 100. And then the volume to be infused, there's 100 milliliters in the bag. We want the entire medication dose to be given. So it's 100, and then we press start, and notice it tells you verify secondary clamp is open, and then press start. Because if you forget to unclamp this, it will tell you the secondary is running, but it'll actually be pulling from the primary. So start. Now, again, we verify that the correct bag is dripping before we walk away. And it is. We have now hung our primary and secondary fluids. What is the bolus? Okay.